Cancer is a large group of diseases with one thing in common. They happen when normal cells become cancerous cells that multiply and spread. Your genes send instructions to your cells, like when to start and stop growing, for example. Normal cells follow these instructions, but cancer cells ignore them. Cancer is a genetic disorder, but that doesn't necessarily mean it's inherited. It happens when genes that manage cell activity mutate or change. They create abnormal cells that divide and multiply, eventually disrupting how your body works. Having cancer is a life-changing event. Knowing what to expect from diagnosis to recovery can empower you and help you take control of your health. Early cancer detection is important for improving patient survival rates and outcomes. By diagnosing cancer in its earliest stages, healthcare providers can offer treatment options that are less invasive and more effective, allowing patients to recover more quickly. When cancer is detected early, the chances of successful treatment are significantly higher, and patients are more likely to avoid the complications that come with advanced stage cancer. Delayed diagnosis, on the other hand, leads to more aggressive treatments, higher medical costs, and lower chances of survival. Furthermore, early detection not only benefits individual patients but also reduces the overall burden on healthcare systems. Treating cancer in its early stages is typically less expensive and less complex, which helps manage resources more efficiently. This makes early diagnosis a critical public health strategy. Through screening programs and regular checkups, healthcare providers can catch cancers before it progresses, leading to better outcomes and improved quality of life for patients. Breast cancer is the most common cancer among women and leading cause of cancer-related deaths. While breast cancer rates were declining before 2004, they have since slightly increased, partly due to the rise in obesity. Early detection through regular mammograms is essential for improving survival rate. Lung cancer remains the leading cause of cancer deaths worldwide. Early detection using low-dose lung CT scans has been shown to reduce mortality by up to 20%. Despite the effectiveness of screening, disparities in access and representation in screening studies highlight the need for broader inclusion of all populations. Colon cancer is the growth of cells that begins in a part of the large intestine called the colon. The colon is the first and longest part of the large intestine. Colon cancer typically affects older adults. Though it can happen at any age, it usually begins as small clumps of cells called polyps that forms inside the colon. Colon cancer happens when cells in the colon develops changes in their DNA. A cell's DNA holds the instructions that tell the cell what to do. The changes tells the cell to multiply quickly. The changes let the cells continue living when healthy cells die as part of their natural life cycle. This causes too many cells. The cells might form a mass called the tumor. The cells can invade and destroy healthy body tissue. In time, the cells can break away and spread to other parts of the body. When cancer spreads, it's called metastatic cancer. But how do we find cancer early? This is where radiologic technologists play an important role, using advanced imaging technology to help detect cancer before it spreads. In the field of oncology, radiology plays an important role in the early detection and diagnosis of various types of cancer. Radiological imaging techniques provide detailed insights into presence, location, size, and characteristics of tumors, enabling healthcare providers to make informed decisions regarding patient cares. Early detection of cancer is essential as it increases the likelihood of successful treatment and improves survival rates. Radiology techniques such as X-rays, computed tomography or CT scans, magnetic resonance imaging or MRI, positron emission tomography or PET scans, and ultrasound are instrumental in detecting cancer at its early stages. These imaging modalities allow healthcare professionals to visualize internal structures, identify abnormalities, and differentiate between benign and malignant tumors.
A CT scan or computed tomography scan is a diagnostic imaging procedure that combines X-rays and computer technology to create a detailed images of the body's internal structure, whether it's bones, muscles, organs, or blood vessels. CT scan provide a clear and accurate images that help healthcare providers make critical decisions. The CT scan works by moving an X-ray beam in a circle around the body. This process allows multiple angles of the same organ or area, providing greater detail than traditional X-rays. The X-ray data is sent to a computer, which processes the information and display it as a two-dimensional images. With advancement in technology, CT scan can now even generate a three-dimensional images. CT scans are essential in diagnosing a variety of conditions. They help detect tumors, fractures, blood clot, and even internal bleeding. Physicians use CT scan to investigate brain injuries, spinal cord problems, and organ damage, providing a clearer picture of what's happening inside the body. CT technologists, who are a specialized branch of radiologic technology, are responsible for operating the CT scan, preparing the patients for the procedure, and administering contrast materials when needed to enhance image quality. They position the patients correctly and follow precise instructions from physicians to capture the necessary images.
Normal findings.
Magnetic resonance imaging, commonly known as MRI, is a non-invasive medical imaging test that provides detailed images of almost every internal structure in the human body. This includes organs, bones, muscles, and blood vessels. MRI relies on a large magnet and radio waves to create these images, offering crucial information for diagnosing medical conditions and planning effective treatment. Radiologic technologists are the front line in catching cancer early, using powerful tools like ultrasound, CT scans, and MRI. Early detection saves lives, so don't skip your screenings.